Kampala is the capital city of Uganda, a country in East Africa lying along the equator. This city is Uganda's biggest urban setting, with a population of approximately 3 million people during the day and 1.5 million in the night. Like other urban centers, people are migrating here from their rural homes in search of better living conditions. The urban population is estimated to be growing at a rate of 5.1% per annum. By the year 2035, Uganda's population is projected to rise to 68.4 million people, of whom 30% will be living in urban areas. The rapid urban population growth is already having serious implications on the demand of basic services, especially in public health. In this film, we look at the challenges of urbanization to the public health sector. People move into urban areas for different reasons. The search for greener pastures is the commonest factor of this population shift.
And when they come here, they find this, the urban setting is not ready for them. So what happens is that you end up with challenges in public health. Challenges which include diseases, challenges which include, other conditions that don't actually promote health.
Stella Mbabazi, a school dropout living in Kisenyi-Lubiri Triangle Parish, has not been fortunate enough to see all that. She hasn't found a job since she moved to Kampala city in 2007 from her village home in Fort Portal district. Before coming here, she dreamed of finding a good-paying job to enable her buy a piece of land to build her own house. Unlike the affluent that enjoy a decent life in organized settlements, the urban poor like Stella are forced to live in the expansive slums of the city. Most houses in these slum areas are dilapidated structures with no proper planning. As one of its activities, the Health Inspectorate at the district headquarters is mandated to guide urban residents on standards of housing in the city, a job it's finding to be rather challenging.
Sometimes you tell a person to construct a house, a toilet. He will tell you, I'm not the owner of this house. How can I construct a toilet? You look for the landowner or the house owner is in London. Such a situation is a bit difficult to handle.
Solid waste disposal is a key challenge in most urban settings. In Kampala alone, 630 tons of garbage is produced a day and only 46 tons is collected and dumped onto the landfill by KCC and private providers. 8% of households and less than 35% of business premises have appropriate garbage bins. Inadequate solid waste disposal systems has forced residents to throw garbage into the drainage channels. The same drainages are equally used as toilets by some residents without proper toilet facilities. The drainages get blocked, leading to an overflow during the rain, and thus the rampant floods subjecting the residents to health hazards. Through the garbage policy, government privatized the collection and management of garbage. In this arrangement, the private sector was given a mandate to collect and dispose the garbage. By working to dispose of garbage in Kampala city at a fee, Great Wastes and Recycling Foundation is one of the private companies supplementing Kampala City Council's efforts. They believe more needs to be done by government to solve the issue of solid waste disposal in the city.
We have unsteady population in Kampala. When you look at the day and night population, they are very different. Such planning is a bit difficult. If you are planning for a toilet, a public toilet in an area, or if you are planning for garbage management in an area, but the population is not very certain tomorrow. So it's really causing a problem which we need thorough planning and policy regulations about.
Access to safe and clean water by some communities living in urban informal settlements poses health hazards. Although majority have access to tap water, some communities can hardly get access to a clean water source. Available tap water is believed to be sold at 100 shillings per jerrycan, a price too high to be afforded by the majority poor. Government, through National Water and Sewerage Corporation, is already working to provide more affordable, safe and clean water using prepaid water meters. The price of water at these meters is 5 times cheaper, with a jerrycan buying at 20 shillings only. Increased health risks in informal settlements demand for increased public health service delivery. The Ugandan government, through the Ministry of Health, provides block grants to the district administrations to provide health services to the public. This is the seat of Kampala District Headquarters, where public health services for Kampala City, Uganda's largest urban area, structured.
We tend to classify our services into two. Those are the curative services and also the preventive services. When we talk about curative services, we are looking at the sick, and also to some extent we are looking at the prevention of the 8 killer diseases in Uganda, and those are actually done in our 10 to 11 health units in Kampala.
Kisenyi Health Centre 3 is one of the 11 health units run by Kampala City Council. The unit offers outpatient, antenatal care, family planning, immunization, HIV care and provision of ARVs, care for tuberculosis, dental care and HIV/AIDS prevention of mother-to-child transmission. The commonest diseases reported here are malaria, diarrhea and cough. The centre serves an average of 300 patients a day, using a small medical staff of only 24 members and inadequate resources. Stella Mbabazi has been waiting for over 2 hours to have her baby treated from cough and malaria. She delivered her child from a nearby private clinic. Although she could be served much faster at that clinic, she can't afford the cost of regular treatment of her baby. To supplement government effort, civil society organizations and the private sector are delivering different services under healthcare. A number of NGO, private hospitals and clinics are providing curative services at a fee. Bishop Dunstan Health Centre is one of the many private clinics operating in Nakulabi Zone 4 in Rubaga Division. The clinic receives an average of 40 patients a day, whose majority cannot afford to pay for the services.
This is an area, it is overcrowded. As I told you, the population is around 30 people, and most of them are low-income earners. When they come, some of them cannot pay for the services. Although we have free services like counseling, immunization, and other services, but those who are paid for, some of them cannot afford because they don't have the money. They cry and beg, and some of them go without paying.
Urbanization can intensify an existing humanitarian crisis which has consequences to social services, particularly the health of all citizens. This is the most challenging global health issue that must be addressed.